Health Minute is brought to you by St. Francis Health. We listen, we heal.
Welcome back. An estimated 12 million Americans have peripheral artery disease, and that can lead to amputation or a heart attack. But there's a new procedure that's offering hope. Jenna DeAngelis reports.
Going on nearly 3 decades with the Lynbrook Volunteer Fire Department and a former NYPD detective, it's clear Patrick Curran has a heart for helping others.
It's an enjoyment to help people and save lives.
But for years, the 59-year-old diabetic has been doing so in excruciating pain. He suffers from peripheral artery disease, a common condition caused by plaque buildup in the arteries, which reduces blood flow to his legs and feet. It's led to extreme swelling and ulcers, putting Curran at risk of amputation, heart attack, or stroke.
This ulcer was obviously not healing because he did not have enough blood supply.
After several failed minimally invasive procedures to open up arteries, Curran was referred to Director of Endovascular Interventions at Mount Sinai, Dr. Prakash Krishnan.
Can I lift up your leg?
Who proposed trying a new FDA-approved device.
You'd be the first person in North America, United States, to have it done. Would you be interested? I says, if it saves me, and it'll save others from getting surgery or an amputation.
It's called Esprit BTK system, described by Maker Abbott as a first of its kind below-the-knee dissolving stent.
This scaffold is a substance that actually allows the artery to be propped open like a stent does. It contains a drug that prevents the reblockage of the artery. And after a couple of years, the scaffold disappears. Till this device was approved, we were all doing balloon angioplasty. However, at the end, these patients kept coming back.
So far, so good for Curran.
So that's very good blood flow.
Who can't wait to get back to doing what he loves.
Getting on the fire truck and getting in the ambulance and
saving lives. Jenna DeAngelis, CBS News.